choosing your medicine. Unlike prescription medications, cannabis therapeutics do not come with a specific dose. Successful use of herbal medicines like cannabis requires active patient engagement, awareness, and feedback. Products and dosages that work for one patient may not work for another. The good news is that unlike most prescription drugs, the patient has more personal control over the dose, called self-titration, and there are a variety of delivery methods, called routes of administration, that a patient may use to find optimal treatment of symptoms. Experimentation may be necessary to determine the therapeutic threshold and preferred delivery methods. Emerging regulations in some states, such as lab testing and labeling requirements, are creating more tools for patients to make educated decisions about product selection. Healthcare professionals and medical cannabis providers may play a bigger role in helping legal patients establish dose and delivery method as clinical research, experience, and the regulatory environment progress. In the meantime, however, patients must take the lead in finding the best solution. The topics discussed in this overview of medical cannabis products include how to select a medical cannabis product that is right for you, a comparison of different delivery methods, and how to use cannabis products. Medical cannabis products can vary from crop to crop, and sometimes medicine from the same garden can have different effects and potency. Broadly speaking, there are two main criteria used in identifying medical cannabis products. First, strain, and second, potency. No one knows exactly how many strains or varieties of medical cannabis there are, but cultivators are continuously crossbreeding existing strains to create new varieties. There are no regulations or accepted conventions in naming strains of medical cannabis, so the colloquial names or street names vary and overlap. You should not make too many assumptions regarding the properties of a given strain based on a colloquial name like skunk, kush, train wreck, strawberry cough, etc. However, patients can expect greater consistency in the future as laws and industry standards evolve. You can start identifying strains by classifying medical cannabis into two broad varieties, Cannabis indica and Cannabis sativa. Sativa plants tend to be taller with smaller flowers and narrow leaves. Sativa medicine is typically invigorating and mentally stimulating. Indica plants tend to be shorter with larger flowers and broad leaves. Indica medicines tend to have a more sedative or calming effect, which often includes sensations more associated with the body than the mind. Many cultivators have crossbred the varieties of cannabis, and the characteristics of these new strains may favor one over the other. This is why you might hear a strain of medical cannabis referred to as sativa dominant hybrid, indica dominant hybrid, or a balanced hybrid. Peer-to-peer information among individuals using cannabis to treat similar symptoms is a helpful tool. Online platforms. Engaged providers are also constantly collecting feedback from the patients they serve and may help you find a starting point. If you obtain your medical cannabis from a dispensary, the staff may have knowledge and resources to help you identify and find what you need. While cannabis contains over 100 compounds, tetrahydrocannabinol, THC, and cannabidiol, CBD, are the two most active in interacting with your endocannabinoid system, a system of nerve receptors in your brain and body that affect appetite, pain sensation, mood, and memory. As medical cannabis regulations evolve, more states are requiring testing and labeling of potency for both THC and CBD. THC and CBD occur as acids in the cannabis plant, known as THCA and CBDA. Once these compounds are heated, they convert to THC and CBD. These compounds affect your endocannabinoid system and treat your symptoms. Studies have shown that in some instances, a combination of THC and CBD may be needed to produce a desired therapeutic effect. If THC is the compound that you need, using a product with high CBD potency can curb some of the side effects from the THC. There are some 5 basic things to consider before choosing a delivery method for medical cannabis. First, let's talk about comfort. One great thing about the variety of delivery methods is that patients can choose what works best for them. For example, some patients will appreciate how easy it is to self-titrate with smoked cannabis, while others may prefer an edible preparation or a vaporizer to avoid inhaling smoke. Cost is also a consideration. Cannabis is not covered under insurance, and the price is still influenced by the unregulated illicit market to some degree. The various delivery methods vary greatly in cost, as well as duration of efficacy. For example, it takes more cannabis to prepare an edible preparation or concentrate than it does to smoke cannabis from a pipe. Think about your lifestyle, too. Delivery methods have varying degrees of odor, side effects, and need for discretion associated with each. Choose a delivery method that will allow you to integrate the medication into all aspects of your life. Availability may also play a role. Every state law is different, and each provider may have a different range of products available. If your licensed producers do not have a delivery method you desire, talk to them about products you want to see. In some states, you can also make your own edibles and tinctures using whole plant cannabis purchased from a provider. Finally, effectiveness can vary. Now, let's consider your choices for delivery methods. Smoking is a common and well-known method for delivering medical cannabis. It can be used with various types of products, such as whole plant, oils, waxes, and concentrates. It has an expected onset time of 10 minutes or less and a duration of 1 to 4 hours. For this delivery method, you will need grinders, pipes, rolling papers, and a lighter. Some of the advantages of smoking as a delivery method are the rapid onset of the medication and the ease of titration. Disadvantages include the odor, sore throat irritation, high visibility, and higher costs, since with this delivery method, you will typically use more cannabis than with other delivery methods. Many people prefer the vaporizing delivery method. This method can be used with whole plant, oils, waxes, and concentrates. The expected on-site for vaporizing is 10 minutes or less, and the duration is 1 to 4 hours. To employ this delivery method, you will need grinders, a large tabletop vaporizer, or a portable vaporizer. Pros of vaporizing are rapid onset, and it's an easy method to titrate. The cons are higher costs, because like smoking, you will tend to use more cannabis with this delivery method when compared to other delivery methods, and not to mention the cost of the vaporizer. Medical cannabis can also be applied as a topical, such as a lotion, salve, or oil. Topical application of medical cannabis has an expected onset time of a few minutes and a duration of 1 to 4 hours. No additional equipment is needed. Advantages include its ease of use. It is discreet, has a rapid onset time, and treatment can be localized to the area of need. On the other hand, it may be difficult to find a topical product that works, so experimentation may be required. Also, some products may have a strong odor. Another delivery method is to ingest your medical cannabis as food and drink. There are various edible products, beverages, teas, and capsules. The expected onset time for ingested cannabis is 30 to 90 minutes, and the effects can last up to 8 hours. No equipment is necessary, other than the product itself. If you are making these edible products on your own, you will also need the other ingredients for the recipe. Pros for ingesting medical cannabis as food or drink include longer duration, sustained therapeutic value. It is discreet, easy to transport, and typically cheaper than other delivery methods. Cons include the fact that it's harder to titrate. Also, during the digestion process, THC converts to a more potent molecule, creating a delayed and sometimes intense experience. Another option is the sublingual delivery method. These products are typically alcohol-based tinctures and lozenges. Expected onset time is 60 minutes or less, with a duration of 1 to 8 hours. You won't need any equipment other than the product itself. This delivery method has the advantages of having a rapid onset time and is more discreet than other methods. The disadvantages are that it is alcohol-based and there may be a higher cost. Tips for titration and dosage. Start with small doses. While some products may have suggested dosages, it is a good practice to start with a very low dose and gradually increase the dose. Keep in mind that each delivery method has a different onset and duration. Choose when to experiment with new products. Every delivery method and product will have a different set of therapeutic benefits and side effects. When trying a new product, make sure you are in a setting where you can address any unwanted side effects safely. Try using new products at night when you are getting ready for bed. After a few days, start integrating the products into your daytime routine. It's a good idea to let family members know that you are trying new products and that you may need help mitigating side effects. To establish an optimal treatment regime with cannabis, you will need to balance the effects of different strains, doses, and methods of ingestion. It may be helpful to record your therapeutic experience on an ongoing basis. One method is through keeping a cannabis use log that captures your experience, including thoughts, feelings, and behaviors. Periodically reviewing that log can help both you and your doctor make decisions about what works best. To start, keep a detailed log, as described on the next page, for at least 1 week. Once you've got a week's worth of information, complete the self-assessment worksheet that follows. This worksheet will help you better understand many things, including your ailments and symptom patterns, your treatment behaviors, and the efficacy and side effects of the cannabis medicines you use. In keeping a medical log, try using a system that is easy to remember and be as consistent as possible. Here are some logging tips on useful information to collect. Date and time. Record every time you consume cannabis with the date and time of day. Amount. Record the amount of cannabis used, gram estimate, or other consistent measure. Strain. Record the name, strain, or variety of the cannabis medicine used. If you do not know the name, write a detailed description of the medicine. Code. Strains are generally described as indica, sativa, or hybrid. You may want to code your entries. I equals indica, S equals sativa, S/I equals sativa dominant indica cross, and I/S equals indica dominant sativa cross. Type is the form of cannabis consumed. Dry bud flower, which is the most common. Concentrates, tinctures and sprays, edibles and drinks, or topicals. You may want to use the abbreviations outlined here. Cannabinoid content refers to the percent of THC, CBD, and/or CBN. If you have this information available to you, write down percentages of each cannabinoid. If you are using edibles or similar, a description of potency and preparation is helpful. Mode. Write down how you used your medication, either inhale via smoke or vaporization, eat, tincture or spray, or topical. Therapeutic effects. List any positive effects you experience. This can include physical, mental, social, behavioral, and other types of effects. Negative side effects. List the negative effects that you experience. For timing, detail how quickly you experienced the first therapeutic effects. When did you feel the peak of relief? When did the effects start to noticeably dissipate? How long until effects were gone? What prompted your cannabis use? List the specific factors that told you it was time for medicine, as well as the general symptoms or conditions being treated. For example, was it pain, nausea, anxiety, or something else? How did you feel? Record your mood and feelings before and after you use cannabis. Where were you? Were you at home, at a collective, in your office, sitting, standing, lying down? Who were you with? Were you by yourself, with a friend, a large group, among other cannabis consumers, or with someone else? What were you doing? Just before you used cannabis, what was going on? What were the activities or circumstances leading up to it? Different people have different experiences with medical cannabis. One individual may feel stress relief, while another feels overstimulated and stressed, and still another feels energized and on task. Based on thousands of years of use, anecdotal reports, and extensive research, we know that cannabis is one of the safest medicines. It is impossible to consume enough to produce a fatal toxic effect in the body. There are many factors that impact the effect of cannabis and how an individual patient feels. Consider these factors in deciding what dose is right for you. The amount used or dosage, the strain of cannabis used, the route of administration or delivery method, the environment or setting, your experience and history of cannabis use, your individual biochemistry, your mindset or mood, your nutrition or diet, your overall health and well-being, and your relative physical strength or weakness. If you are unfamiliar with its use or you are unexperienced, you should familiarize yourself with the side effects prior to use so that you can use cannabis effectively. Remember that what may seem like negative side effects to one user may be the desired therapeutic benefit to another. Some possible side effects include uneasiness, hunger and thirst, redness in the eyes, drowsiness, sleeplessness, short-term memory loss, feelings of euphoria, decrease in blood pressure, and increase in heart rate. Cannabis has been safely used as medicine for thousands of years. In fact, its safety track record is so strong that following a review of the science in 1988, an administrative law judge working for the U.S. Drug Enforcement Administration said that marijuana in its natural form is one of the safest therapeutically active substances known to man. Judge Francis Young also noted that it is physically impossible to eat enough marijuana to induce death. Despite its overall safety, patients may still experience unwanted side effects. Even after carefully choosing a cannabis product and delivery method, A patient may experience acute uneasiness, palpitations, disorientation, and/or nausea. These side effects are typically temporary, but can be quite frightening. There are simple antidotes that a patient can use to help end these symptoms. They include lemon juice, pine nuts, water, smelling pine essential oils, and calm breathing. For more information, click here to see Taming THC. As with all medicines, if the side effects are causing significant distress, seek medical attention. Make sure that you are in the appropriate setting and have the time to address the side effects of your medicine. Don't try new products in public settings until you know the effects. If you are inexperienced with cannabis or are trying new strains, higher doses, or a new delivery method, consider having a family member or caregiver present to help. Finally, do not attempt to drive, operate machinery, or do anything else that could jeopardize your safety or anyone else's while you are experiencing any mental or physical impairment from medical cannabis use. It is better to be too cautious on this point than not careful enough. Be aware that some states have strict laws and severe penalties for driving while impaired by any substance.